diagnosed. I used to be very thin talaga. Thin, with regular menstruation.
Okay.
But late 2015, sometime around December or November, I was diagnosed with PCOS. That time ang PCOS, hindi pa siya basically well explained. Dito na si PCOS nag-strike sa health ko. Nung nag-start akong mag-breastfeed, tapos in-stop ko na lahat. As in, kasi syempre, when you're breastfeeding, hindi ka pwedeng mag-diet. Kaya din siguro, I started having hypoglycemia, especially ng afternoon. Tapos, yung weight ko, as in, ang laki ko, I started gaining weight. Super drastic yung pag-change ng weight ko from size 2 to size 8. As in, ang laki. Tapos, ang baba na ng confidence ko. Sabi na ng mga brother ko, mukha na daw kong aparador, mukha na daw kong gasol. Aside from the hypoglycemia ko, drastic weight gain, meron pa akong migraine, chronic migraine. Mainit, malamig, whenever I'm stressed, ang sakit. So, parang binabasag talaga siya. Nahihilo na ako talaga, nagsushoot up yung blood pressure
Kahit
ko.
walang trigger.
Kahit walang trigger.
How did you come across Simply Nature PPARs?
Nalaman ko siya through Ma'am Jansen and Mr. Jhen. So, they introduced PPAR to me kasi one time we were having lunch. So, very big yung appetite ko. Akong excusing mom, always tired meal. Ako, he looks 30s, 20-something, mga ganon. So, sabi ko, gusto ko ako din. Kailangan, paglaki ng anak ko, mukha lang kaming friends. When I started using PPARs, first month pa lang. Actually, first week pa lang, I started texting them na, Sir Shyan, Ma'am Jocelyn, I don't have episodes of migraine at all. Kasi yun talagang kita ko. Kasi everyday, nafe-feel mo eh. Wala, even if it's cold, it's hot. Yes, kasi sabi nila, ang hirap daw, sabi ng doctors, once you got diagnosed with DM2 or diabetes, it's really hard na i-reverse.
Exactly. How did your doctors react?
They were amazed yung OB ko. First time, kasi OB ko na sila before pa eh. So, first time, since 2015, kahit ako, first time naming makakita ng clear, normal.
Guys, just to let you know, as you can see on your screen, the result actually says ovarian is bilateral. So, both sides.
Yes, bilateral. More than 20. Tapos may specific size pa siya. I can share naman yung lab result. Tapos ngayon, left is already clear and normal. Tapos yung right ko, reduce na yung size. So, working on it para ma-clear na siya. So, first of all, I wanna thank Sir Shyan and Ma'am Jocelyn. Really, as in, sobrang thankful ako sa kanila. I thank God for their lives. I have nothing but gratitude for them. Having this product improve my way of life talaga, as in. Tapos more pa para yung ibang friends ko, actually nakikita na rin nila eh. Encourage ko na rin sila, medyo nire-refer ko na rin sila. Tapos kaya mo rin to.
Exactly. And just like how Sir Shyan and Ma'am Jocelyn did it to you, it wouldn't be hard anymore because they see the improvement, they see the result on you as well.
Living witness na sila eh kung ano yung nangyaring changes. Good morning, I am Monique B. Marzan, 31 years old. I'm currently working as a property manager here in BGC. I was diagnosed 2015 with PCOS and I started gaining weight, having high blood sugar and then high cholesterol after I gave birth. And then when I started using PPAR, the migraine episodes, hypoglycemia, and my drastic gaining of weight stopped. As mentioned, I started to lose weight and look more vibrant. So I trust Simply Nature.
Even before pregnancy, I'm already taking PPARs. My husband and I, we were really taking, I think during the time we've been taking it consistently for 5 to 6 months already, PPARs tablets. So, I even think that helped us during the this pregnancy because based on our experience, we had 2 miscarriages before my 3rd pregnancy and my successful pregnancy. And that time, we've been told that, oh, it's not healthy, that's why you're losing the baby. And then we're just, waiting on the Lord and praying for His timing. And during the time when I got pregnant, I also realized that, oh, actually we've been taking PPARs. So, because I've read and heard that PPARs helps with cell repairs, it strengthens your body, it's high in antioxidants and all that. You know, I really think that that contributed for us to have a healthy pregnancy. And yeah, that's what I also took during that time. After I have given birth, I really had difficulty because I had emergency CS. So, but after, on the 3rd day onwards, I was actually feeling better. After giving birth, we're gifted with PPARs, so praise God, and that has helped me a lot because they said that the hormonal changes do not just happen during pregnancy and even after pregnancy. So we started taking PPARs also. And I know mommies who have given birth, I know you can relate to this. If you have experienced constipation before birth, when you have given birth, it becomes like more. It gets to the next level of constipation. So I'm glad I was able to take, and I was introduced to Cleansing Plus of Simply Nature even before pregnancy. So when I experienced all this constipation, when I took Cleansing Plus, it has helped me with my regular bowel movements and to be able to release easier and faster. When I felt constipated, because it's true, even after you have given birth, if you're already constipated, it's like it's gonna go to the next level of constipation. I don't know how it happened, but when I read about it, it's all because of the hormonal changes that happens in our body and our body adjusting and healing. So it's going through a lot. It has helped me because especially if you have given birth, whether that's normal delivery or you had cesarean, you're not really allowed to put pressure when you're about to go. So you're not allowed to push. So the Cleansing Plus really helps, no, for you to be able to release, better and easier. What has helped me in this pregnancy journey and even before that and even after is that I was taking PPARs. My husband and I were taking PPARs tablets. So that has helped me with, of course, the hormonal imbalances. It has helped us to regulate, and it has given us more energy and have healthier bodies. So it has no contraindication, so that could also help you. So you may try on your own and test it for yourself. Hi, I'm Nesta Vicencio, and here's my son, Ethan Kairos. So I had an amazing pregnancy journey and recovery with the help of Simply Nature PPARs. Thank you, Simply Nature. We love you.
Good morning, I'm Mrs. Melinda C. Hispano. Ako po ay na-diagnose ng stage 2B breast cancer and I'm from Muntinlupa City. I'm a public school teacher. Nung nalaman ko po na na-diagnose ako ng breast cancer, syempre may devastated po. And of course, the whole family, parang our world, falls apart, sobrang down. There is no symptoms eh. I just felt the lump. Dalawang lump siya sa right breast. And I was not really going for a check-up sa lumps. I was, magpapa-check up ako sa OB-GYN ko. And I was advised to go to the surgeon kaagad. So, after po ng operation, I was asked to go to oncologist. The protocol is to have 8 cycles of chemo and 33 radiation. When I was on the hospital, sa aking bed, browsing through the Facebook, I saw the face of Dr. Jansen. Sabi niya, makakatulong po sa mga chemo patient, yung Simply Nature PPARs. So if you will just try, malaking benefit po sa katulad naming mga cancer patient. I was advised to supplement chemo with PPAR powder saka tablet. So at first I was hesitant kasi very mahal po siya. Pero first chemo ko, taking PPARs, hindi po ako nahirapan. So I was expecting na yung mga nababasa ko, napapanood ko ng mga side effect of chemo. Hindi ko po siya naramdaman. So I was telling my family na parang maganda po yung PPAR sa akin. I finished the whole 8 cycles without any problem. Thanks to my doctor and the Simply PPAR. Kasi po, even my co-teachers, even my family, sabi po sa akin, hindi ka mukhang may sakit. So that must be a blessing from up high there, no? That I was able to meet Dr. Jansen and I was able to take Simply Nature PPAR. Latest result of my laboratory, all are normal. Yes, thank you, Lord. Continuous pa rin po yung tablet. So I just ordered 6. 6 ngayong May. So that would last for ilang months. My latest ultrasound, fixed pa din po siya. No calcification or anything. So I thank God for that. Mapapayo ko po sa mga pasyente po na katulad ko, go to the right doctor, no? You pray for the right doctor. Kasi ako pinray ko lang para bigyan kayo ng the right supplements. And para yung journey nyo, yung cancer journey nyo, will be very successful. Kaya nga sabi ko, during my PPAR journey, sabi ko sa sarili ko na I will be the most successful chemo patient in the whole wide world. Thanks, PPAR. I will highly recommend po Simply Nature PPAR kasi based on my own experience, it helps me a lot talaga. And it's a blessing to me na take ko yung PPARs. Kaya nga ang sabi ko, I will be the most successful chemo patient kasi may supplement ako galing sa Simple Nature, which is PPAR powder and PPAR tablet. So, blend together, it helps me a lot. And I'd like to thank my daughter, si Cadiz, and also my husband for taking care of me. Hindi siya nagsisisi on that part. Thankful po siya. Kaya nga, nung sabi ko, a-attend kami, and he was very supportive, binatid niya ako dito. I am Melinda C. Hispano. I'm a public school teacher. I was diagnosed with stage 2B breast cancer. Upon knowing my situation, it was really a very devastating event. I was advised to do 8 cycles of chemotherapy and natatakot ako dun sa chemotherapy. But with the help of Simple Nature, na-surpass ko, nakatulong po sa akin. It's a big help. Lahat po ng side effects ng chemo, hindi ko po naramdaman. So, I'm very, very thankful to Simple Nature because it really helps me a lot. And ang feeling ko, I'm a very successful chemo patient because of Simple Nature. I trust Simple Nature.
Good evening, everyone. I'm Sheila, and welcome to another episode of Simply Healed Webinar. This program is proudly brought to you through the collaborative efforts of Simply Nature International and Simply Healed Medical Group, united by a shared mission to support healing through education and science-guided care. As an international leader in wellness, Simply Nature specializes in high-quality supplements sourced from a unique strain of microalgae known as PPARs. This research-backed nutritional approach is widely recognized for its ability to support cancer patients, boost immune function, and improve metabolic health. It is particularly effective for those looking to naturally manage blood sugar, blood pressure, and high cholesterol. Now imagine this. You notice some spotting between your periods. Or maybe you've already gone through menopause and one day you see a bit of blood. Your first instinct might be just to shrug it off, or it's just stress, you tell yourself. It's just my body acting up. It's normal. We live in a world where women are practically conditioned to expect discomfort, irregularity, and unpredictable changes from their bodies. We've been taught to carry on, push through, and ignore the minor inconveniences. But what happens when the thing we dismiss as minor inconvenience is actually a red flag? Welcome. Today, we are pulling back the curtain on a topic that doesn't get enough airtime. Despite it being the most common gynecologic cancer in the developed world, the endometrial cancer. And specifically, we are going to talk about why what looks like normal bleeding might actually be your body's urgent warning sign. To truly understand how endometrial cancer operates, we have to look at how masterfully it disguises itself. It doesn't always arrive with agonizing pain. Instead, its primary symptom is incredibly mundane, abnormal uterine bleeding. To help us recognize the red flags, let's lay out the three heavy truths about this disease. First, abnormal changes depending on your life stage. If you are premenopausal, it looks like bleeding between periods, heavier than usual flows, or cycles that suddenly begin or become wildly irregular. If you are postmenopausal, it's much more stark. Any bleeding or spotting, even a single drop of pink on a tissue, is abnormal. Second, there is no such thing as normal postmenopausal bleeding. Yet, so many women delay seeing a doctor because they mistake it for a random late period or a harmless hormonal hiccup. We tend to wait for worse symptoms to appear before we justify taking up a doctor's time. But with endometrial cancer, waiting means giving the disease time to spread. And third, early detection is a literal lifesaver. Endometrial cancer has a remarkably high cure rate, but only if it is caught early. Shifting our mindset from let's wait and see to let's find out right now is the most powerful tool we have. Our goal today isn't to spark panic, but to spark conversation. Because when it comes to uterine health, what you don't know can hurt you, and what you're too embarrassed or hesitant to ask might be the very thing someone else is in this room needs to hear. Maybe you're wondering right now if your specific symptom you've experienced counts as a red flag. Maybe you want to know about the exact diagnostic tests to ask your doctor for, or lifestyle factors tie into your overall risk. Nothing is off the table today, and no question is too small or too personal. I want to open the floor for all of you. And what are the things you've been told are just normal that you want to challenge today? We're about to start the AMA, and please know that the intention of today's webinar is to make sure that we answer more questions coming from all of you for us to be able to empower you even more in your journeys. So without further ado, let's dive right in. Leading tonight's AMA or Ask Me Anything portion are highly respected health experts. First up, it's a pleasure to introduce Dr. Jansen Calalan, an alumnus of St. Luke's College of Medicine. Dr. Calalan is a distinguished diplomate of both the International Board of Lifestyle Medicine and Philippine College of Lifestyle Medicine. He currently serves as a consultant specializing in integrative oncology across several premier institutions, including Alta Integrative Medicine and Wellness Complex, Perpetual Health Medical Center, Las Piñas, Tree of Life Wellness Center, Centro Holistico, Simply Healed Medical Group, and Meta Medica Integrative Healthcare. He will be joined tonight by CEO behind Simples with years of international speaking experience to share deep insights on how health serves as a foundation for true success. Let's all welcome Mr. Shyan Lim. Hello and good evening, Dr. Jansen and Sir Shyan.
Good evening, Dr. Jansen. Good evening, Sheila.
Alright. Good evening, Sir Shyan. Good evening, Dr. Jansen. There you
Good
go.
evening.
Today,
Can you hear us?
Hello.
now we're about.
All right. Okay.
Dr.
All right.
Jansen,
Yes,
can you
yes,
hear us?
I can.
Okay.
Okay, that's good to hear. All right, are we ready to start off our questions for tonight?
Yeah, let's
Go
go.
ahead. Sure.
I think
All
both
right,
Dr. Jansen
okay.
and I are a bit tired today, but we'll just do our best to answer the questions, right? Yeah. So we're very happy for
Really
the
appreciate it.
people coming on. Yeah, please, we are very happy to answer.
Thank you. Thank you. Thank you both, gentlemen. All right, for our first question, coming from Mr. Macalino, is it also possible for PPARs to cure Parkinson's disease?
Oh, okay. Cure, no. Cure,
No.
no. No. But I want to let you know this one first-hand experience, right? My father-in-law had Parkinson's. Okay, so and my sister-in-law was the one who took care of him because we were in the Philippines, right? So what they fed my father-in-law was actually liquid extract PPARs. Okay, so according to the doctors who were looking after my father-in-law, they were saying that his progression in his Parkinson's was uh, better than the normal Parkinson's patient. So my father-in-law could still could move around quite well. He enjoyed eating and could continue eating even when he lost his ability to speak properly. So, as Parkinson's progresses, the patient actually becomes like, he just says, and they don't really speak. Their movements get more and more difficult. In the end of the day, my father-in-law actually died peacefully in his sleep. So no, it didn't cure Parkinson's, but apparently it made the progression, I guess, slower. He didn't progress very quickly in his Parkinson's. He was about 80 years old, something like that. So I can just share with you that from our other doctors who specialize in neurology, one of the key factors is that she used our products because Simply Nature PPAR helps to modulate inflammation. So she believed that she used this to help modulate neural inflammation as well, right? So there we go. That's my personal experience from it. Yeah, Dr. Johnson, maybe you can share from medical mechanism point of view, any
Okay.
potential. Yeah.
Parkinson's disease is actually a disease that they describe with Parkinsonism. So the Parkinsonism is a syndrome. So the Parkinsonism,
Okay.
so when we talk about syndromes, it would be a myriad of different symptoms. That's it. And then they name that combination Parkinson's. Okay, that's what Parkinson's is. Now, why the do so if you look at the cause of Parkinson's disease, what is being affected is the dopamine
Dopamine
production
production.
of the
Okay.
brain, um the voluntary movement
Okay.
of Now,
Okay.
the specific part of the brain that is being affected by Parkinson's disease is what we call as the substantia nigra pars compacta.
Wow, okay. Very medical.
It's a mouthful, but
Yeah.
basically that area of the brain is the one that produces dopamine. Okay?
Oh, wow. Okay.
So in Parkinson's disease, in autopsy studies of patients who died with Parkinson's disease, they noticed that the area of the brain, the substantia nigra, is paler compared to those who does not have Parkinson's. Okay, it's paler. So that pigment seems to control the amount of dopamine that that area produces.
Oh, okay.
Okay. Now, why is it so that that area, that the substantia nigra, becomes paler or or it produces less dopamine. So the main cause is actually unknown. If you do AI search or Google search, the answer that you would get that the root cause is unknown. But they associated or correlated Parkinson's disease to a number of causes, which actually is linked to inflammation. Okay? So for patients who have Parkinson's disease, then it would be very important to control neuroinflammation so that
All right, okay.
they can have less symptoms, or the symptoms would not be as pronounced. And you can actually, if you do it right, no, you can actually even slow down the progression of the Parkinson's. So that's
Oh, okay, okay.
so it's there's no cure for this.
Yeah,
Theoretically,
just slow down.
yeah, just slow
Just
down.
slow
The,
down.
yeah, the cure is, well, with progression of science. So I should say that in our age, in this day and age, there's still no cure for Parkinson's
Yeah.
disease. There's no way to reverse the
Correct.
substantia nigra from becoming pale and pale and pale. But
Yeah.
eventually in the future, they might have gene therapy or perhaps a stem cell implant over that part of the brain so that you can regenerate the cells of that of the substantia nigra. Okay? To regenerate so that you again produce dopamine. So, but this is a thing of the future. Just by me describing this procedure means that there's hope in curing this disease. I mean, I am not I'm not a neurologist or a neurodegenerative specialist, but the mere fact that I can describe this process is that I mean, scientists around the world are thinking of how to cure Parkinson's disease. So
Yeah,
eventually,
because
I
it's a
think
big
we
thing.
can get the cure. I believe within our lifetime. Yeah,
So that means slowing it down
slowing it
buys
down. Yeah.
buys a hope that you slow it down enough that a cure can come up. I mean that's
Yes, hopefully. But of course, when the cure comes, there would be a lot of steps, no clinical studies for it to be
yeah.
before it is released in the market, no.
Oh,
So
Jansen, this is a very good question, and I'm curious because that day on Channel News Asia, I saw a program. So this lady, I think in her 50s, early 50s, late 40s, diagnosed with Parkinson's, right? And then apparently has become an activist for Parkinson's patients. So she does folk dancing, volunteers at community centers, and apparently there are many people who are being diagnosed with Parkinson's at an early age. My father-in-law was like 75 years old, something like that, when he got Parkinson's, right? So already, so we were sort of more or less prepared. And I guess to him it's not so scary because he's growing old already. So this is like part of growing old. But I'm sure for a late 40s, early 50s person, their life is still very how shall we say, full and active. So from your general knowledge, again, you're not a neurology specialist. Like, how long before Parkinson's really onsets and starts affecting a person's life? And could you diagnose Parkinson's really early, like in the early stages, and that you still have 10, 20, 30 years ahead of you before you really become yeah, so
yeah.
I'm just asking for this view. And also for
Um
his family, right? If someone in your Parkinson's has in your family has Parkinson's, does this increase your chances of having Parkinson's? Is it
yes,
a
it can
gene thing?
be, yes, it can
So
be
it's a
genetic.
gene
Yeah,
thing.
it
Oh
can be
wow.
genetic. But
Okay.
so far, if you look at the factors, the risk factors of Parkinson's disease,
Mm.
genetic factors would be a small portion. Majority would be
Okay,
environment,
small point.
still environment.
Environment.
Okay?
All right, okay.
Exposure to toxins, environmental toxins, especially.
Oh
So,
wow.
the way we diagnose Parkinson's disease is
Mm.
clinical. Clinical means through physical exam alone. That would be enough. Then we do an MRI, then try to see patterns in that imaging, which can confirm or more or less confirm our diagnosis. But Parkinson's disease is mainly diagnosed clinically.
Okay.
Okay. Yeah, and then early or how soon can Parkinson's disease impact a patient's life? It can take years, even
Okay,
decades.
wow. So that's one good news. It's not like, 6 months later
So
you're
it's
going to
slow.
be,
It's a slow
yeah, it's slow.
progression.
Okay, all right. Okay. Wow. If it's so the good news is if it's a slow progression and you can still do things to slow it down, uh, uh you don't have to be so panic today lang, right? Yeah. So again, for this particular viewer, I when I was watching the video, I couldn't tell that that person had Parkinson's. She really seemed totally normal, moving, dancing, singing. But of course, being diagnosed with Parkinson's made a big change in her life. It's like she's trying to live the most out of her life right now. And she became super active in all aspects of her life and her social life as well. So yeah, but we can only give you a brief hope. Doc, probably you will make better sense of this, but I was just looking at a few mechanisms, and one is there is actually a PPAR agonist, specifically PPAR gamma agonist can rescue dopaminergic neurons. All right, so that's one possible mechanism. Mitochondrial preservation. Wow, doc, really? This year, I mean, we're already in May. We've been talking about mitochondrial preservation quite a lot, part of longevity, and I think Parkinson's is something people who are growing older are concerned about. So mitochondrial preservation also helps also helps to slow down onset of Parkinson's, anti-inflammatory response. Yeah, this three. Yeah, this three. Okay, so there you go for the viewer. At least there's a supplement, something that you can take, right? Since it's a slow thing, I guess I would recommend, like, if you're going to take any supplements, why don't you take PPAR tablets, right? It's something that you can take for years. Financially, won't affect you. It's something that is very affordable, and yet it contains PPAR agonist, PPAR gamma, which is beneficial for your condition. So for a long chronic condition like Parkinson's, it's good to be able to go on a long supplementation that you can maintain with no toxicity built up, many benefits, including your metabolic syndromes, which includes blood cholesterol, blood sugar, things like that. So yeah, why don't you start there and continue the research, and we wish you all the best. Yeah.
We're off to a good start. Very encouraging. Thank you, Doc
Oh,
Jansen. Thank you,
interesting
Sir Shyan.
topic. Yeah.
It is
Mm.
off the topic, but we welcome questions. Anything under the sun, just about health.
Mm.
Thank you. Thank you. All right. So for our next question coming from Miss J Bet, thrown to us privately. Question is, I have tumor on my lungs and my throat. What would be the best recommendation?
What does
Have
she
it
mean?
biopsy.
Yeah, correct. So has she seen a doctor? Obviously, she's seen a doctor. Or else she can't know that she has tumors in her lungs, right? Yeah, okay.
Thank you. Thank you. All right.
Yeah.
For
Go
our
ahead.
next
So,
question.
doc, once a patient goes for a biopsy, if it's not benign, if it's malignant, what would your general advice be?
Go for surgery. Cut it out.
Okay, cut it out.
Immediately,
All right.
because if it is cancer, it would be easier to treat if the headquarters of the tumor is not there. So it would be best to have it removed. No, but of course, no, if the tumor is in multiple places, then surgery would the benefit of surgery would now be for symptom
Diminished. Okay.
relief. Then that's it. Because you will not be able to get the improvement in survival rate in survival rate if from surgery alone, because the mass
Tumor
is in
has spread.
multiple places, it's in different places. Okay, so um the role of surgery now then would be symptom relief. So say for example, if the mass is blocking your throat, your
Airway.
esophagus, etc., then you can do surgery to bypass or to create a separate access to bypass that area so you can eat. So that's what I mean by surgery. Now, if so, from the comment, no, the mass seems that it's in the lungs and in the throat. So this is a typical example of a metastatic stage of if it is cancer, no, it's metastatic. So if it is the case, then the approach would be systemic treatment first, meaning you treat the whole body. Okay, you treat both at the same time. So that would usually include chemotherapy, um, targeted therapy, immunotherapy. On my side of things, that's also systemic treatment. So on my side, what I can give is supportive so that the chemotherapy would be more effective. What my role then would be to make sure that the chemotherapy being given by the med-onco is effective. It will have maximum effect against the tumor, and to support your body so that you'd be able to finish all cycles of the chemotherapy. Okay? So that would then be my role. And of course, once you go into remission, I mean, if the tumor has shrunk satisfactorily, that the medical onco is not going to give you any additional treatment anymore, then for recurrence prevention or further control of the size of the tumor or the tumor burden, then that's also going to be my part. Okay, so I would give you supplements, medications to help you control the size of the tumor. So that's basically my role.
So the fact that you have tumors in the lungs and throat, so that is of concern. So I think, as Dr. Jansen said, first thing is go for a biopsy so that you will know whether it's malignant or not. Doc, when a patient has, okay, I think Doc will not be able to answer this question because he needs to examine the patient to be able to know. I was just originally wanted to ask him if you have tumors in the lungs and throat. Uh, that sounds it sounds like a malignant spread, right? Or is it possible that it's unlikely that you have tumors in your lungs and then tumors in your throat? Yeah, correct. Not normally these nodules don't happen like that, right? Yeah. So for this patient, please don't wait. Proceed with the recommendation your doctor has already given you, right? To go to the next step of probably diagnosis, which is to confirm what it is. Again, to all cancer patients or first-time viewers, one thing that I want to encourage everyone, I was very encouraged when Dr. Jansen showed this to me about 4 years ago. And then after that, I did my own research, which is we always come in with the assumption that cancer is a death sentence. But actually, when you look at the statistics, the survival rates and the success rates are actually very, very high. All right. So we are talking about success rates in the 90 percentiles, 80 percentiles. Even a 70% chance is actually something that is very hopeful, right? You have a very strong chance of making it. You just have to make the right decisions quickly and seek help. All right. And of course, have a consult with Dr. Jansen so that you can explore. So what's the I'll just take the chance now to share why Dr. Jansen is great. Is this right? I think when you speak to Dr. Jansen, you will open up a wider range of options for yourself, right? So for example, those who are afraid of chemotherapy and don't want to do chemotherapy, so you actually want to do natural, talking to Dr. Jansen, you will learn how you can manage the side effects of chemotherapy, right? So then it gives you an option that you say, I don't want to look at, suddenly become possible. Those of you who want to do chemotherapy and don't want to go natural, talking to Dr. Jansen, you might realize how natural can be used not as a treatment, because some people want to treat cancer naturally and you don't want to do that. You want to go conventional. But then you might realize also how natural can support the conventional therapy so that you will be more successful. There are actually natural supplements, like Dr. Jansen shares sometimes. Some types of cancer chemotherapy drugs actually work better with PPARs, right? So there are some synergistic though. So those of you who have cancer, when you consult Dr. Jansen, I think it opens up more treatment options for you, allowing you to realize that there are more options that are open, and then he'll help you choose the right one for you.
I couldn't agree more. And with that said, for the person who asked Miss J. Beth, for you who asked this question, please do go for a consult. And for those of you who wish to have a consult with Doc Jansen, simply type in how to consult. Miss Beth or Miss Irish will definitely get in touch with you immediately. Thank you. All right, for our next question, once again thrown to us privately, coming from Miss Rita. Okay, question is, I am a breast cancer survivor. How can Simply Nature help me sustain my recovery, and what products would you recommend? Congratulations.
Oh, congratulations. So for you, I would just recommend honestly, Simply Nature Simply Nature PPARs tablets. Right? That is actually our most basic, and the good news is the price is the same as a high quality multivitamin, right? But it's specifically very beneficial for cancer patients because it contains PPAR agonists. It's also a superfood. It's high in chlorophyll. All that. It will help you manage inflammation. So as a cancer survivor, you want to make sure your chronic inflammation in your body is kept under control. You also want to have your immune system constantly being strengthened. So I can tell you specifically that it will increase dendritic cell activity, which is basically the natural scanner in your body's immune system. So that means your body will be scanners will be turned on. So if there are any circulating cancer cells or anything, the body's immune system is more alert, right? To be able to pick it up early and then deal with it. Definitely I won't say precursor. The steps to developing cancer has always been metabolic syndrome. So a person who develops metabolic syndromes decades later will have a higher chance of developing cancer. So you still got to seriously manage your blood sugar, blood cholesterol, all that, right? You got to keep that healthy. That keeps you anti-cancer, right? So Simply Nature PPAR tablets is just so great about that, all of that. Now, if you really want to go for oil tune, if ever you feel weak, right? So the danger of any cancer patient is this. If you go through another bout of illness, let's say you fight pneumonia, all right, your immune system is going to be taxed and everything, right? So every time you weaken your own immune system, you of course think about you think that there will be a risk where your cancer will relapse. So I give you a very simple example. I used to work in a financial institution, so it's crazy. In one floor, we can have 2 leukemia patients, right? So it's statistically very high for a small density of people, right? So the reason is because I work at investment, I guess investment banking environment, very stressful, very, very stressful. So stress will weaken your immune system as well, right? And add a lot of load to your body system. So cancer rates are actually abnormally high in the company that I work in. So you can think about that as well. So if ever you feel weak, you want to go for like a regime, you can consider going for our powder extract just as a booster, and then see how you will feel after that, right? So these are the options. Feel free to chat and ask Sheila. And of course, if you ever feel tired and weak, right, you can also consult Dr. Jansen. So he has lots of other protocols that can give you that quick recovery, because every time we go for illness, our body loses its strength. I'm talking figuratively. So we're talking about, so you need to bring it back up as well, right? So speaking to Dr. Jansen will avail you other options beyond Simply Nature PPAR tablets to help you to do that. But yes, the product I would recommend for you is Simply Nature PPAR tablets because it's affordable. It's something that you can take every day, and it's beneficial for you, and the benefits build up long term. So the more you take it, the more the effect compounds.
We were talking about this last night, sir, right? That some of our patients used to be taking the liquid or the jar. Now that they are survivors, they are on tablets. The whole family is actually taking it to prevent.
Yeah, after that, the whole family take. Yeah.
Okay, Dr. Johnson would like to add anything for.
Yeah, Doc, would you actually recommend something stronger like a powder or anything for anybody
Right.
who has already fought cancer, or would you also just
Why
stick
not?
to?
Yeah. So the way the way I use PPARs is not based on number one, whether or not you have cancer.
Okay.
Number two, whether or not you are at a higher stage or an early stage. It's not dependent on that.
Oh, wow.
I use the risk factors. I look at the risk factors. So say for example, you are someone who I'll take you as an example. Currently in remission. So since you're in remission, then the natural inclination is to give you the lowest, which is the tablets. Actually, if you look at the metabolic profile, the blood chemistry profile, if your inflammation is high, if you are diabetic, if you have high blood cholesterol, all these things, then I would not choose the tablet. I would choose
Oh,
the soft
okay.
gel.
Oh, you choose a soft gel, even more effective. Yeah, correct.
Yeah, I would choose the soft gel.
Okay.
If it's really, really bad, if you have an autoimmune disease on top of it, then I would probably consider the liquid vial, even if you're in remission. Okay,
Yeah,
so it's
okay.
dependent on the inflammatory markers and how good or bad the metabolic health is. Okay, so that's how I choose which product I go for. But the fact that you are someone who was diagnosed with cancer, then of course Simply Nature PPARs would always be on the table. You would
Yeah,
always be
correct.
included in the
Yeah, in
protocol.
one form or
So
another, right?
yeah,
Yeah.
in one form or another. So that also tells me that hey, this person needs immune boosting, probably needs inflammation lowering, um, probably a little bit of detox. Then yeah, that would drive me to decide whether to go for the tablets or the extract. Okay. Yeah.
Yeah, I was about to say earlier that my son is a cancer survivor himself, and I'm very very blessed to have been guided by Mr. Shyan Lim, by Doc Jansen Kalalan all along, all throughout these years. And it's Sir Sean is correct. Even though you are already a survivor, it would still be good to be guided by a doctor like Doc Jansen, so you can
Yeah.
stay on the safe side.
And
Right?
this is one thing, again, one thing wonderful about Doc Johnson's choice. I'm so glad for the cancer patients, Doc Johnson didn't become an oncologist. For your information, that was already his direction. Even when he was studying med school, he was already gonna be an oncologist, right? But somewhere along the line he changed. Because an oncologist can only help you until your cancer treatment is over. So once your cancer markers go back to normal, the oncologist cannot actually advise you much or help you much, or the oncologist doesn't have tools, right? Doesn't have any drugs to keep you cancer free. They only have drugs to fight cancer. They don't have drugs to keep you cancer free. So Doc Johnson's choice of doing what he's doing now, becoming an integrative doctor with specializing in cancer care and treatment, actually is able to give you advice and also tools from lifestyle adjustments to natural protocols to Simply Nature PPARs, and all these range to help keep you cancer free. So again, you've come to the right place tonight. You asked the right question, and you can start with the tablets or going for a consult with Dr. Johnson if you actually feel, okay, you know what, I think I sound like I have metabolic issues. I should go for the soft gel. If you're not too sure, then have a consult with Dr. Johnson.
Exactly. Thank you. Once again, please just type in how to consult. Our caring HCS, Miss Beth and Miss Irish, will message you right away. Thank you. All right, for our next question, another interesting one coming from Miss Debbie Luces. For my husband with skin cancer and having a chemotherapy right now, but it seems that the buccal or the tumor gotten bigger. What would you recommend?
Okay, this is a very interesting case.
Oh, okay.
So most patients at this point will just quit. They will stop receiving treatment altogether, look for other means, no? Usually. Now you have to understand that this is the nature of cancer. Then if it is skin, then melanoma. If it is melanoma, then this is how melanoma is by nature. And I should say that melanoma is one of the more studied cancer types because a lot of doctors are having trouble treating it. Okay,
Oh, wow.
melanoma is highly resistant to treatment. It is by
Okay.
nature like that.
Hard to treat.
Okay,
Okay.
yeah. So what happened? What happened? So first, let's try to describe what happened. No? So you have skin cancer. So uh you did undergo chemotherapy. So from this, no, I would think that the cancer was kind of advanced already when it was diagnosed.
Mm.
So that's why you did the chemotherapy. Now, the chemotherapy should eradicate all the cancer cells. Now, how is it that instead of the tumor shrinking, it instead increased in size? So
Mm.
one theory that they are um, postulating is inside the tumor will be different cancer cells. So they are dividing every single minute, every single second, and they are dividing. So when they divide, they usually divide into, it can divide into a more aggressive form. It can divide, it can mutate or evolve into a form that will resist treatment as well. Okay? Now, sometimes, so you have, so in a tumor, you have different kinds of cancers, and these cancers are kind of like um having competition against each other, competing for fuel, for nutrients, eating one another. So you have an entire jungle in there. Okay, so when you give chemotherapy, guess what? The chemotherapy will eradicate all cancer cells that is susceptible to it. So the tumor would react. Can it shrink in size? Not at the moment if it's just for a few cycles, but definitely some cancer cells would be killed. Now, sometimes the more dominant cancer cell line or the more dominant cancer cell family can be overcome by a more resistant one. Okay, so
Mm.
I'll rephrase this. I'll rephrase this. So in a neighborhood,
Okay.
you have different families.
Yeah.
Sometimes
Yeah.
the dominant family gets killed. Okay,
Mm.
when they get killed, of course, there would be a new another family who will take over.
Mm.
Okay, so the new family who took over sometimes the more resistant one to the treatment. Okay,
Mm.
that's why even if you go on and give the treatment, it's not responding anymore because it has evolved to resist the chemo.
Mm.
Okay, so if it is the case, then should you just opt out of chemotherapy altogether? No.
Mm.
Because chemotherapy, there are different kinds of chemotherapy treatments. And chemotherapy is always the faster treatment that can reduce tumor burden or to reduce the amount of tumor you have. Okay? So you just have to receive a different kind of chemotherapy. Now, here's the thing. You have to understand the patient that the patient has already suffered the side effects of the first one. So the patient would have a lot of reservations in receiving the second. Okay, so you have to give the right support for the patient. So what kind of support would that be? Of course,
Mm.
support for the side effects, support for the immune
Mm.
system.
Mm.
You have to walk the patient hand in hand to finish all the treatment cycles. Now, this is just giving things, giving empathy, sympathy to the
Mm.
patient, giving support to the patient. No, but it goes a long way. Now, scientifically, can you still do more in order to know what treatment would be okay and what would not be okay? Yes,
Mm.
you can do a liquid biopsy. So the liquid
Mm.
biopsy, the sample there is just your blood, and the blood would be analyzed for the circulating tumor cells or the cancer cells that's swimming in your blood. So the circulating tumor cells would then be tested against different medications and natural extracts. And then from that information, you would know what works and what does not work. So that when you receive the next round of treatment, we know that what you are receiving, the cancer cells would be susceptible. It will die, in other words. Okay? Another thing is the liquid biopsy will also show us what what is it what is it what is it inside that what is inside it that makes it resist treatment, and we can suppress those so that the next time that you receive another round of chemo, it would be effective and reduce that tumor burden.
Okay.
Okay, so that's the right path there.
Doc, I have a question. Because if not, your explanation will go very, and then I will forget my question. Okay, it sounds like the liquid biopsy that you are suggesting, right, is different from when a CT scan. A CT scan sees where the tumor is, right? And a liquid biopsy actually shows more of the composition or the nature of the cancer cell, which allows us to so it sounds like the normal diagnostics, like from like MRI and all that, these are imaging, right? So it shows you what the thing looks like. But here, when you say liquid biopsy, it sounds more like you can find out what is the thing made of. So the treatment, because you see a ball of ice and a ball of mercury or a ball made of cotton wool, it still looks like a ball, right? It's just round, but you don't know what material it's made of. So if you know it is made of ice, then you take something hot, it will melt, right? If you know if it's a piece of metal, then you probably have to heat it up to melt it up. So or do something else, or put acid for it to be affected. So it sounds so different. It's like got more tools to now identifying how you can attack the cancer rather than just seeing the cancer. Am I correct to share? I mean, to say that. So
Yep.
it increases my interest in your liquid biopsy as well, because when you don't know what to do, you need more information. And so since this method of diagnosis provides information very different from a CT scan, right, from a normal biopsy. So, okay, here, doc, since it's a skin cancer, right, so they can definitely easily get a skin sample. So why would they need to test the blood instead of you can actually look at the physical, you can grab a piece of their skin, look under the microscope. What is the difference over here?
Logistics, because if you are going to collect a tissue sample, you have to make sure that you have to preserve a cold chain for that, and then you have to go into a hospital, get a sample, then send it over. Okay, so it's going to be very difficult for patients to undergo that kind of procedure. And different countries would have different setups, no, in order to facilitate the mere act of getting a sample from the skin. Okay, so that's why the laboratory who I work with, they develop a procedure that would apply for all countries around the world. So just use a simple blood extraction. Now, so this is skin cancer. Um, the blood extraction would suffice because for this case, because you were prescribed with chemotherapy already. So my guess is the cancer is already systemic. And if the cancer is already systemic, then the cancer would travel no other way but by blood or by lymphatics. So the cancer would be present in the blood. So that's why a blood sample would suffice. And it's always easier to ship blood sample out and internationally and to collect blood sample rather than getting a tissue biopsy, a tissue sample, because for a tissue sample you need a surgeon for that. Some countries would require a hospital for that. Okay, and yeah, so the hurdle in collecting that sample is going to be very high if you need a tissue sample. So for blood, it's more convenient. Yeah.
Oh, okay. So I just want to take this opportunity to remind everyone this is not a consultation session, right? But I'm sure as we talk, even as I listen to Dr. Jansen, it creates ideas in my head, to say, oh, that this I can explore for my cancer treatment. Wow, I never thought about looking in this angle from the treatment from this way before. I thought it was just, but so this is one of the purpose of our discussions, right? So if you really want a consultation, go for a consultation with Dr. Jansen. But we do remember our discussions over here is to open up your understanding so that you understand the treatment that you're getting from your current oncologist, the treatments, the possible treatments that are out there, why some people will think this way, why did someone suggest biopsy, why liquid biopsy when you can actually do a skin sample? Yeah. So the whole purpose is to encourage you to think out of the box so that you can fight your cancer to the best of your ability, whatever is available to you. Yeah.
Thank you. I just want to say on behalf of our viewers, sir, and Dr. Johnson, thank you for explaining the discussion or your answers the best way you can. I mean, I heard Dr. Johnson explaining it like a neighborhood.
Yeah, today is use an analogy. Dr. Johnson not being super medical today.
Right. And of course, Sir Sean used also the ball to
Yeah.
describe the liquid biopsy. So thank you. Thank you for doing all of this for our viewers today. Okay, all right. For our next question coming from Mr. Resenio Velasco, question is, what papers can you recommend for renal mass, no biopsy, and they want to remove my kidney?
Go for
I would
consultation,
recommend
please.
liquid. Yeah, but yeah, you have to go for the consult. But if it is like this,
Then
if you
Alright.
if I'm going to choose,
Can you hear
if
me?
if you force me to choose, it would be liquid,
Am I heard?
obviously.
Hello?
But
hello,
for
Sheila, you're interrupting.
yeah, so it would be liquid if I'm going to choose, no, with no other information. But seeing this one, the question, so you have a renal mass.
analogy,
You have biopsy because to know malignant. If it is renal cancer, then the only solution here is it's really surgery. It's really surgery. That's the recommendation if you follow the guideline. So of course there would be a lot of patients who would have second thoughts in going for this. Okay.
Because it's removing the kidneys, doc. That means
it's removing the
possible
kidney.
dialysis if both kidneys have to be
Yes,
removed.
possibly. Yeah. If it is only one kidney who's affected, then it's okay. But you can live with one kidney. Okay? No problem with that. But if undergoing dialysis is a very, very big possibility, then essentially you've killed the patient already. I mean, in terms of quality of life. Okay? So for this one, what other treatment modalities can you explore? Okay, so I'm going to just name a few, and it is not a guarantee that they are already here in the Philippines. Okay. So one would be hyperthermia. Hyperthermia can you can actually reduce tumors or reduce tumor burden by heating the tumor. Okay, so that's what hyperthermia therapy is. With hyperthermia therapy, it can also improve the tumor permeability and the immune system infiltration of the tumor. Okay, so that your immune system can help fight the cancer cell, eradicate the cancer cells, and to help improve penetration of treatment for in the tumor. Now, for renal cancer, chemotherapy will not work. It doesn't work at all. So the only other options that you can go for would be drug repurposing and the natural extracts. So this is also where liquid biopsy is very, very beneficial because you would know what will kill and what will not kill the cancer cells. Another therapy that you can go for would be SOT. SOT is supportive oligonucleotide therapy. So what is this SOT? This SOT, so imagine it to be like an antidote Okay? So what happens is, with the liquid biopsy, they will get the circulating tumor cells from your blood. And then they will identify the dominant gene that drives tumor growth or cancer growth. Then that gene, once they have identified it, they will formulate an antisense RNA against it. So that antisense RNA is the antidote to the poison. So imagine the poison to be the gene, the dominant gene driving cancer growth. They will develop an antidote for that. And that antidote is the one that they give you. So SOT treatment is also for tumor burden reduction. It can shrink tumors. Okay? But again, this is not part of the guidelines anymore. So, and the sample size no, in which it was studied is also very small. So we cannot actually say for sure what the success rate will be. But this is something that can still be considered because aside from surgery, there's really no other option.
Okay, so this this is the first time, Doc, when you when you said something just now and it stunned me for a moment. You said something like, okay, chemotherapy does not work for this particular kind of cancer. Then suddenly in my mind it's like, huh? If there's no chemotherapy, what do we do? I mean I mean it's so synonymous that if you have cancer, it's chemotherapy, right? Or immunotherapy, right? So yeah, so I think for this particular viewer, hearing Doc Jansen speak, I think gives you hope and somewhat confidence. Why don't you go for a consult with him so that you can ask more questions as well? You can to find out what to do, because Doc Jansen also quite clearly recommends surgery. And your question is very strong. You say they want to remove my kidney. You sound like they're trying to take your life, right? So obviously you are very adverse to that idea. So perhaps spending time with Dr. Jansen or having a consult will give you a better picture, a better idea. But one thing great, Dr. Jansen has listed out a whole different options of treatment for you. Simply Nature PPAR liquid could be something that you take right now, because it's going to help no matter what you're going to do. It's just going to help, right? Will it become the primary treatment or foundational treatment? We will know more during your consultation, but then it's just really going to help your situation. Just now we talked about Parkinson's, right? So if you do it, like Parkinson's will move forward no matter what you do. What you want to do is slow it down so that you can enjoy your life more, so that you can have higher quality of life as long as possible. For cancer, once you strengthen your body and you sort of slow down the cancer, it opens up more time for other options to be explored, right? For you to learn a bit more and come across a doctor that will then share with you an option that your other doctor didn't share with you. So Dr. Jansen talked about hypothermia treatment, or is it cryo treatment? Wait, that is not. Is that available? Is that available in Philippines?
We have, okay, I know of a center of a
Okay.
hospital who has a
So it's not
hyperthermia
a standard procedure lang. That if you go to a normal hospital, they won't even bring it up, right?
Yeah, they won't even bring it up. Now, hyperthermia, this is already actually being used in other countries like Korea, South Korea, Malaysia, Thailand, I believe they also has. I think Japan also has.
Wow,
Now
to know that South Korea and
hyperthermia,
Japan use is quite comforting. Yeah.
yeah. I mean, I went to a conference in Korea last year, and
Okay.
they were talking about hyperthermia in that conference. So the doctors who are speaking about hyperthermia are basically most of them are radiation oncologists. Okay, some of the delegates, no, some speakers we had there were radiation oncologists, medical onco, and a
Oh,
few
wow.
integrative
Okay.
oncologists. So in South Korea, they have a hospital there that has 13 hyperthermia machines. So this hospital also does integrative oncology protocols. So in that same department, they have IV vitamin C, your alpha-lipoic acid, all these things that you can search on the internet that governs under integrative oncology. So hyperthermia is in that section of the hospital. So in Korea, the hyperthermia treatments are covered by insurance, private insurance, but not government insurance. Okay? So in the Philippines, I already know of a hospital who has hyperthermia machine, which is in Zarate General Hospital. So that's the only one. That's the only one. Actually, they approached me and introduced the machine to me. But of course, I'm at Perpetual Health, so they're trying to bring the machine in the hospital, and hopefully
Oh, what?
there would be positive outcomes to this. So we have to wait and see. Have to wait and see. But hyperthermia machine, we already have it in the Philippines. One would be at Zarate General Hospital.
I think
That's what.
so. I think this particular viewer should have a consult with you. I mean, he doesn't want to lose his kidneys, so he definitely would want to explore all the other options. So for this particular viewer, please, and for the rest of our viewers, thank you very much for allowing us to explore this entire line of question. I hope it just goes to show that where you go, sometimes the information or the treatment options can be limited. All right. So if you go, let's say, to a provincial hospital, the doctors there may have limited options and they don't tell you what other possible options there are. So even if you go to top hospitals, if they are conventional, they will not share with you some of the more cutting edge or some of the newer forms of treatment because because there's a process and procedure. So that's why in Singapore there is a hospital called the National University Hospital of Singapore. This is a research hospital. So that means you will get access to things like novel chemotherapy drugs. That means new chemotherapy drugs and things like that. So it depends on where you go. What you will then hear about options is different. So I hope that for all our viewers tonight, we serve the purpose of showing you some options that you may not have heard or seen before. And that will just make tonight's program already very fruitful for everyone. Yeah. Sheila? Sheila? I think Sheila is lagged. Doc, I think okay, we have hit our timing,
Thank
so
you, Sir Sean. Thank
okay,
you,
she's back.
Dr. Jansen. All right. I guess this
We'll
will
end
be.
lang. Yeah, we'll end.
Thank you, Sir Sean. Thank you, Dr. Jansen. Hi.
Okay,
Yes.
Sheila, I'll take over. Sheila, I'll take over. All right. So we thank you for that very serious discussion. We still we're having a bit of levity here, but
Hi.
definitely our
All right.
topic is still
Can
serious one.
everybody,
Uh,
apologies. I think
you-
good my
yeah,
bad.
so
Yeah.
why don't you log out and log in again?
How
Okay, are you back?
I think am I back?
You
I think
back?
I am. I apologize.
Yeah, she is.
Okay. Okay. Then maybe Dr. Johnson, final
Yeah,
words
okay,
from you.
So
Yeah.
for patients out there who are looking for more options for your treatment, some options that you can explore would be drug repurposing, some natural extracts, liquid biopsy. We can also explore that. Okay? So these are the things that we can talk about when you come in and have a consult. No, so just remember that whether or not, regardless of where you are at the stage of treatment, no, there's always something that we can do. Okay, but you have to know this. You have to know this. No, this is for all patients who are prospective patients in the future or my existing ones. Okay, do not um do not have me as your only doctor, please, okay? Because we're dealing with cancer. You still need medical oncologists oncologists who are practicing inside the hospital who can admit patients. Okay, my practice, the limitation is that I cannot admit patients. Okay, and it would also be, well, if you do get admitted, I also don't have a role in there. So I just refer my patients if the patient needs admission, okay, in the hospital. So you still need your medical oncologist, your radiation, your surgical oncologist. So please stay in touch with them. Don't just disappear and um lost to follow up just because they recommended a treatment that you are not quite that you don't that they don't like. Okay? Because at the end of the day, it's you who's going to decide because it's your body. Everybody around you, your doctors would have no choice but to follow you. Okay, we cannot kidnap you and force you to go for that specific with what treatment, right? So you just have to tell your doctor that this is what I want, and what I just want, a request, no, a request from you guys is that you have to understand the decision that you are making. Okay, the pros and cons. So this is informed decision making, so you understand what you are doing. Okay, and if you do understand what you're doing, and you have a decision that you already made, we will respect that decision. Okay, so that's the message that I want to put out. So see you in the clinics. Good night. I'll give the flock to Sir Shyan. Bye.
Thank you, Doc. Thank you, Dr. Jansen.
I think is what a wonderful message by Dr. Jansen, and what a responsible message, right? So I think tonight you can see our role here on this program is to provide you education. Our role is also to let you understand how we work, how as a consumer, right, and in a sense, the client or the patient. When you say patient, then you sound like you don't have authority. I guess maybe when you are a customer, you know your rights as a customer. So for this last point I want to make is that you are actually the client consuming medical services. So do remember that you have the agency, you have the authority of choice. You can ask questions. You should try to understand what treatment you're going for. Medicine is not as complicated as we think. The words they use in medicine, the terminology, the anatomy part, they all sound very complicated because the words are very long. But the principles in which medicine work and how it works, what are the risks, you'll be very surprised. It's quite easy to understand. Except that sometimes maybe when a doctor explains it to you, they use very long words. It confuses many people. So that's why on our program, I try to give very simple analogies for us to easily understand what these treatment options are. So never be intimidated by them. Ask questions. Dr. Jansen already shared, stay with your doctor who is very good at what he does, but he may not be very good at explaining what he does. So sometimes you have another doctor who is very good at explaining what the first doctor is doing, right? Because some doctors are very good at their job, but they're not very friendly, right? And then so that's why I think a doctor like Dr. Jansen, an integrative specialization in cancer, he understands what the oncologist is doing. So sometimes you'll be surprised. Dr. Jansen will explain to you what your oncologist is actually doing to you, how they are treating you. So then you better understand. You say, okay, then I have more confidence what my other oncologist is actually doing. So I love what Dr. Jansen's final advice to everyone is, stick with your doctors. You might need to find another doctor to be able to better understand what's happening. But because the best surgeons may not be the most friendly surgeons, the best oncologist may not be the oncologist that can explain things very well to you as a patient, but he's very good at what he does, which is to treat your cancer. So you don't necessarily want to go with the friendliest doctor because he may not be the best doctor medically in his medical skills, but he is the best doctor in his communication skills. So all this is where our program comes in. And I want to invite you to meet us face to face in 1 week's time. Sorry, a little bit more than 1 week's time, right? Not this coming Saturday, next Saturday. So where I excel at understanding PPARs. And of course, me and Doc Jansen, because we always do this program, we excel also at being able to speak to you and help you understand what you're going through. So sometimes we may be the good link to what your oncologist is doing for you or what your surgeon is trying to help you, but they may not be able to connect with you the same way we can, because I guess that's where our strengths are. So we work together, the whole medical community. And our goal is just to be with you from your start of your journey to the end and offer as much assistance as we can. Okay, so with that, I'll hand the time back to Sheila.
Thank you. Thank you, Sir Shyan. Thank you, Dr. Jansen. Once again, for everybody or to everybody, thank you for your questions and thank you for considering our program as a program of value while you journey with your own health battles. And on behalf of our patients and viewers, once again, thank you, Sir Shyan Lim, and thank you, Dr. Jansen Kalalan, for putting so much effort and care towards all our questions tonight. Now, just some few announcements before we go. Exclusive for website orders only. Yes, you can still buy our PPARs liquid extract or PPARs powder extract with no shipping fees. So whether you are ordering from Metro Manila or anywhere nationwide, you can still avail this free shipping promo. And once again, this promo is only available via website. That's www.simplynature.ph. Also, before we say goodnight, we want to share a powerful double action deal for your health, because if you purchase a PPARs powder extract jar or PPARs liquid extract via our website, and you may receive or you will receive free AD Pro Serum, combining internal cellular support with premium external skin nourishment. Plus, you'll enjoy the free shipping on your order. But if you are on a tight budget, that's okay. We've got you covered with a free Renew mask included when you purchase any PPARs soft gel tri-pack, the three packs of PPARs soft gel capsules. These exclusive offers are available via direct or via website. So grab yours today. Also, please stop struggling with stubborn eczema, psoriasis, and eczema and level up your skin game with AD Probiotic Serum. This advanced formula is specifically designed to restore your skin barrier for long-term results. And the best part is that you can buy it with and get free one. This buy one, get one promo is still live, but only for a limited time. So grab your duo now on Shopee, Lazmall, our website, and via direct before this exclusive deal vanishes. Also, big news, health warriors, your favorite flagship products here in Simply Nature have officially landed on our TikTok shop. So we're making it easier than ever to fuel your recovery and boost your immunity in just a few taps. So head over to our official Simply Nature TikTok account now to grab your wellness essentials. All right. Also, please, great news, of course. We've been announcing this and a lot of you already know that we are expanding our hours for a Saturday dose of wellness here at BGC office. Visit us this Saturday from 10 a.m. to 4 p.m. for an exclusive advice with our resident pharmacist, Ms. Jhen. Get expert pharmacist doses of pharmacist choice advice on boosting immunity and cellular nutrition to elevate your health journey. So even better, because if you buy our flagship PPARs liquid extract or PPARs powder extract on site here in our office, you will get free Simply Nature umbrella. So this exclusive Saturday only deal is the perfect way to complete your regimen. So please contact or get in touch with your assigned client service officer. Now, if cancer has touched your life, remember that remission is only the beginning. The real work lies in the building a body that sustains long-term recovery. So please join us this coming May 30, that's a Saturday at SMX SM Aura BGC for a powerhouse seminar entitled Beyond Remission, where elite experts unpack the science of metabolic stability and inflammation control. Seats are limited, so please watch this video below to see why this event is a very non-negotiable step in your healing journey. Please watch this.
Hi everyone, this is Shyan Lim from Simply Nature and I bring you good news. Backed by popular demand, doing our regular SMX event. And the topic for upcoming May 30th event is Beyond Remission, building a body that sustains recovery. So if you are a cancer patient and you have questions about your diagnosis, what treatments are available and which treatments to take, if you don't know how to combine conventional treatments with natural treatments, then this is the place to be, because I will be joined by one of the top integrative oncologists in the nation, Dr. Jansen Kalalan. Right, he will be sharing about innovative approaches to supporting cancer. So Dr. Jansen actually specializes in supporting cancer patients undergoing conventional treatment, but he's also an expert in integrative treatment for cancer. And again, like I said, it's a great event for you to ask questions because there will be a live Q&A or Ask Me Anything segment where Dr. Jansen and I will be sitting on stage together, and perhaps we will be trying to invite other specialists as well, and you can ask your questions and all of us will be able to be there giving you live answers. This is an opportunity that you cannot miss. So seats are limited, secure them, and feel free to bring a loved one or caregiver with you. All right, so mark it down on your calendar, May 30th. It is a Saturday, 8 a.m. to 11 a.m. at SMX Aura in BGC. See you there.
So we hope to see you this coming May 30. And of course, we also hope to see you next week for another episode of Simply Healed webinar on May 28th. That is once again, same day, same time, Thursday night at 7:30 p.m. as well. Once again, thank you for spending your time with us today. This is Simply Healed webinar powered by Simply Nature International and Simply Healed Medical Group. And remember, your curiosity about your health conditions and your victories over cancer and metabolic diseases are what keeps us going. Because here in Simply Nature, we're always with you from start to healing. Thank you, everybody. Good night and God bless you all.